cavity. Of course, the superior wall of abdominal cavity is diaphragm, so we have the pair of inferior phrenic arteries. But remember, this parietal artery have one visceral branch. Do you remember which? From inferior phrenic artery starts superior suprarenal artery, which supplies suprarenal gland. Suprarenal gland. Then,
Inferior phrenic artery. Inferior phrenic artery.
inferior phrenic artery supplies diaphragm and also give one visceral branch, which is called superior suprarenal artery. It supplies the suprarenal gland. Then we have 4 lumbar arteries, 4 pairs of lumbar arteries, and they are very similar to the posterior intercostal. They have the similar direction. Firstly, they passes laterally, and then they flexes on the anterior abdominal wall. So they supply the lumbar region, the lumbar vertebrae, lumbar part of spinal cord. They supply the lateral and anterior abdominal wall, all the muscles and peritoneum and the skin of abdominal wall. And we have one unpaired artery, which starts from the level of the bifurcation. It is called middle sacral artery, which passes downwards into pelvic cavity and supply the muscles and nerve plexuses inside the pelvic cavity. And there are many organs inside the abdominal cavity. And we can divide them into 2 groups, paired and unpaired. Paired branches of the abdominal part of aorta, the most wide, the widest of them is renal artery. Renal artery. It passes into renal hilus, supplied with blood kidney, but not only the kidney, but also the abdominal part of ureter, and also it gives inferior suprarenal artery, which supplies the suprarenal gland. And all the endocrine glands have the networks, arterial networks for their blood supply. We can find, already we have found the superior suprarenal and inferior suprarenal arteries. But there is also middle suprarenal artery, which has the origin from aorta. Superior one starts from inferior phrenic, middle from aorta, and inferior from renal artery. 3 arteries form the networks which surround the suprarenal gland. And at last, according to prenatal development, do you remember that internal genitalia developed it firstly in abdominal cavity, and then they descend into pelvis or into scrotum. So they are supplied also with a branch of abdominal part of aorta, arteria testicularis, arteria ovarica. Ovary artery, which in female organism, and testicular artery. Because of descending these organs from abdominal cavity during prenatal development, the arteries have the origin of aorta, and while descending of the organs inside the pelvis, the artery becomes longer, and then it passes downwards in pelvic cavity, and in male organism the artery passes inside the inguinal canal and then into scrotum until the testes. So the blood supply
adult arteries.
of internal reproductive organs, the reproductive glands are provided by the branches of abdominal part of aorta. And the most difficult part is the unpaired branches. We have divided the abdominal cavity into levels: superior level, middle level, and the inferior level is the same as the pelvic cavity. So we'll discuss only the superior and middle level. In superior level, we can describe some organs. Which organs are located there?
Stomach,
Stomach,
Liver,
liver, pancreas, duodenum, spleen,
diaphragm, inferior part of
duodenum, of course.
gland,
Well, and all of these organs are supplied with the branches of celiac trunk, truncus celiacus. Trunk. Of course, the trunk is the very short but wide artery. So it has the origin from aorta at the level of the 12th thoracic vertebra, and it has a length of about 2-3 centimeters, and then it is divided into 3 arteries. Here is the trunk.
Yes, sir.
It is small,
Celiac axis.
and then it gives the most narrow one, passes to the left and then upwards, and it is called left gastric artery. It passes along lesser curvature of the stomach, supply the lesser curvature and the abdominal part of esophagus. That's all. The second one, here it is. The artery which passes to the right is called the common hepatic artery. Common hepatic artery. It passes between the 2 layers of hepatoduodenal ligament. And inside this ligament, it divides into 2 branches. One of them flexes downwards, and it is called gastroduodenal artery. And the second one passes upwards and to the right. And it is called the propahepatic artery. Propahepatic artery also gives the branch to the stomach. It is called the right gastric artery, supplying the lesser curvature. And it has the stomatosis with the left gastric artery. And then the